Hi, my name's Kenny Cook. I work with Clackmannanshire Council Sports Development Team as the Active Community Officer. The main thing we were with working in partnership with the NHS, we were looking to reduce the amount of people that needed hip or knee replacements through taking part in exercise. But it may be that some of them still need hip and knee replacements, but hopefully through the exercise we've given them, that can delay the inevitable if that needs to happen.
I'm Dr. James King. I'm a GP in Tillicootree and clinical lead for Clackmannanshire. Was involved in my role as clinical lead with some of the early groups, looking at setting up the project, using the best-in-class joint pain advisor as the first point of contact for referral now rather than automatically referring to orthopaedics, and giving space in our practice to the service so we've got a room to operate in.
My name's Peter Reid. I am an advanced physiotherapy practitioner working in the Best in Class project as the joint pain advisor. Key things I do in the programme is primarily to see patients in GP surgeries rather than the GP themselves, and act as a key link between a number of different services, whether it's dietitians, community exercise programmes, and more importantly act as a first point of contact for someone who's suffering from lower limb joint pain.
Well, I have arthritis in both hips and in my knees, and I feel more mobile. That's why I've come, so that I can walk better and perhaps get rid of the stick that I'm still using.
I have enjoyed the exercises. I feel they are beneficial. I'm finding a difference in my mobility. I was getting to the point where knees were creaking and things. I enjoy the exercises. They're not overly, I'm not a gym person, but this is a nice relaxed exercise and I feel we're being looked after here.
Definitely come along. A lot of people think if they've got a knee problem or hip problems, exercise won't help the pain, but it can help the muscles and the joint area around about the knee and the hip, which can help reduce their pain and improve their overall health and flexibility. It also has other side benefits. It can help with blood pressure, reducing blood pressure. It can help with weight loss and that sort of thing. So if anybody's got any doubts, probably because they've got the perception that exercise is going to be difficult or maybe make their knee or hip worse, I would say no, definitely come along, and we'll do everything we can to help improve that for you.
The ones I find most beneficial are walking and the sort of lunge exercise, which I feel stretches the knee.
I think the main successes we've had in the programme are the number of people that have engaged in the service. We've had well over 500 people so far see ourselves or Kenny, one of the physical activity coordinators. Rather than seeing the GP or formal support, we've also managed to reduce the referral to orthopaedics by around 30% in quite a short space of time. So that's probably one of the main successes we've had, as well as increasing awareness of what we do and helping people self-manage.
My mobility is a lot better and I've lost 1.5 stone.
My favourite exercise? The ones I can do, obviously. The ones that involve rising, the ones that involve lifting my feet.
I would say go for it. It's been very helpful, very useful to the patients. The patients that I've spoken to after they've been through the programme have thought it's been the best service they've had, and those who were reluctant to look at it have benefited from it and have made decisions not to have surgery.
We've had a lot of good feedback from people coming along. Some people have reduced the amount of medication they're taking. Some people just have a wee word just as a past and say, my knees feeling a lot better or my hips feeling better. Their flexibility is improved, they can touch the ground more, they're in less pain. So the feedback we're getting from the people attending the classes has all been positive.
Favourite exercise? Don't
don't really have a favourite one. I just enjoy the whole class, yes.
Yes, I've encouraged quite a few people to come here, and a lot of the things is so that they can get help and be prevented from needing an operation, because obviously it's a big thing to have a major operation.
Favourite, yes, I like the lunges, shall we say, yes. As long as you don't have too many.
Three things I would share would be always involve your patient. Quite often the patients don't want surgery, they don't want to go to orthopaedics, but they get sent there anyway, or they get sent to a service that maybe isn't appropriate. So always ask that question, what do they want to get out of going? Always use community supports. So we have Active Clacks here that Kenny, the coordinator, runs very well. And have a very consistent approach to what you're doing. Make sure that all the areas in the health board are doing a very similar thing, and that's what we're trying to achieve in Falkirk and Stirling as well as Clacks.
Shall we say, I don't spend as much time sitting about, you know, up and downstairs, and I went to one of the talks that they had with the physio, and they have a wee exercise card that they give, and I've been doing that daily as well, and I definitely find it very beneficial.
In relation to the class, you'll enjoy yourself, that'll be one thing. You'll meet new friends and guarantee that your health will improve.
Seen a huge benefit from introducing a service like this. Out of the quality of life questionnaires we handed out, 60% of people showed a significant difference in their quality of life and pain levels. There was around 20% were better but not statistically significant, and there's a very few number who weren't better, so we know that it's a service that works, so definitely to encourage people to come on.